David, the ruling this week was quite a landmark ruling, I guess. I know you raised this at the start of the pandemic yourself. What's your take on this? And can you sort of cast our minds back to what things were like in your care homes at the start of the pandemic?
Good morning, and thank you for the opportunity to give time to this, because the ruling vindicates everything we were saying. In fact, you may recall I wrote to my local MP, Mr. Philip Davis, on many occasions saying that we should have a fire break between discharge and into care homes. What happened was many of our residents were actually in hospital for medical reasons. And the remit came out on the 28th of March that all non-urgent cases were to be discharged. That meant that they had to come back home. It wasn't a case that we could say we're refusing admission. This was their home. We'd cared for these people for several years. They would not test them despite being in hospital and everybody knowing that there was asymptomatic patients in hospital. The Select Committee was told on the 26th of March by Professor Doyle that patients had 5 days, possibly, before they showed any symptoms.
So when the line came out from, Matt Hancock and the department, they didn't know about the asymptomatic sort of transmissions. When they said they didn't know about that until later and very much viewed it as a Public Health England failure. What did you have to say about that, David?
I would ask you the question, really. How can a minister whose own scientific group reported in January and February that there were asymptomatic patients, that we had witnessed what had happened in care homes across Italy, France and Spain in February, how could a minister not be informed by his own scientific advisory committee that there was no asymptomatic patients? When we've known about Typhoid Mary since 18 dot, how do that flu can be transmitted without people having symptoms? How did he not know?